Hi, my name is Frankie Holmes. I'm a retired medical doctor. I previously treated breast cancer and I did clinical breast cancer research. And before I retired, there was so much information being published about the importance of exercise in terms of your immune system and also in my field in the prevention of breast cancer. Patients who exercised regularly had a decreased incidence of breast cancer, and if they were unfortunate enough to get breast cancer, being fit and having a good immune system allowed them to tolerate the treatment for it much better. Now, fortunately, I don't have breast cancer, but I'm an active 70 years old woman, and I would like to stay that way up until my very end, whatever that may be, and I certainly hope it's quick, maybe being abducted by aliens or being thrown into graphite by descendants of Boba Fett. Nonetheless, I know that the secrets to longevity are eating properly, getting adequate rest, staying mentally alert and healthy, and exercise. Now, I've got the first three of those down pretty well, but that last thing, exercise, gee, aside from long walks with my dogs, I find it boring and painful. And as hard as I try to make an appointment with myself to get out there, do the weights, do the core, I simply can't do it. For those of you who are disciplined, you are gods and goddesses, and I laud you. But for a mere mortal like me, I need the commitment and the appointment with my trainer. And so 3 years ago, I engaged with Ken. I don't want to disappoint him by not appearing or by canceling. Ken makes the boring and the torture so much more bearable. He's a great conversationalist, and I can't tell you how many movies I've seen with him telling me the story. The other thing is, he adjusts his training to my specific needs. I have some health conditions, and he is able to do that. Now, when I retired, I moved out here to West Texas, or at least we vacation here a lot longer than I used to. So I was able to bring Ken with me by remote training. It's pretty simple. You can see I'm sitting on the bench. My husband has weights in the back, which we use a little bit. But as you know, if you're training at home, it's very simple equipment. And if Ken's been training you at the gym, well, the equipment you need is very little. Your stand-up straight, your stretch straps, a few dumbbells, and of course a bench like I'm sitting on or something that you can do your push-ups and cores with. So if you're homebound and you can't get your training done, don't give up on this. It's so important for your mental health and for immunity that you need to keep up with this. And if you feel a little misgivings about remote training, give it a chance. Just try it one time. And if you haven't tried it, well, check it out. It's useful, and I feel so good after I have done it. Take care of yourself. Be well. Remember, we are all going to need to be healthy and invigorated when this is all over to help those families that have been broken, suffered loss, to help rebuild our economy, and just to help each other. Thank you. Happy training.